Good morning to everyone. Today we are going to discuss the topic of essential newborn care. Myself, Ms. Velvezhi, M.Sc Nursing, Department of Child Health Nursing, Assistant Professor, ES College of Nursing. You all very well know about essential newborn care. So essential newborn care is a very important thing after the baby will birth. So after the baby will birth, what all the care should be given to the newborn baby, especially the newborn baby should be admitted in NICU or pediatric intensive care unit. So you all very well know about the topic of essential newborn care. It is very familiar to all of you. So in the introduction, essential care of the normal healthy neonates can be best provided by the mothers under supervision of nursing personnel or basic primary health care providers. So essential care mainly given for only normal healthy neonates. In the normal healthy neonates, that care should be given by only by the mothers with the supervision of nursing professional. So nursing personnel comes under staff nurses or the doctors or primary health care providers. Next, about 80% of newborn babies it require minimal care. So totally 80% of newborn babies required minimal care to the babies. Next, definition. In the definition of essential newborn care, it is a comprehensive strategy to reduce the death of newborn through cost-effective interventions before conception, during pregnancy, immediately after birth and postnatal period. So in the essential newborn care, it is a one strategy. In this strategy, mainly it will reduces the death of the newborn before conception. Before conception means it is the beginning stage of the pregnancy. At the time of pregnancy, immediately the baby will birth and it will goes to the postnatal period. What are all the immediate newborn care? First is maintenance of temperature. Second is establishment of open airway and circulation. Third is identification of newborn. Fourth one is vitamin K injection. Fifth one is initiation of breastfeeding. So these are all the 5 points given by immediate newborn care. So one point we will see in the next slides. So first we are going to see maintenance of temperature. When we are maintain the temperature, if the baby is in radiant warmer, the first step is immediately dry the infant under a radiant warmer. The baby will birth, immediately we will dry the infant. After that we will dry the infant. The baby should be put into the radiant warmer. In the use of radiant warmer, it will produces the thermal control to the baby. Second point is skin to skin contact with the mother. With the use of skin to skin contact, the parent and the baby bondage should be there in the skin to skin contact, and it will maintain the love and trust relationship between both other. Third, keep the neonate's head should be covered. After the baby will birth, the neonate's head should be covered immediately. Third is rooming in. In the rooming in, both baby and the mother should not be separated in the one room. Both baby and the mother should be present in the same room only. The baby should not be separated from the mother. So these are all the things comes under maintenance of temperature. Next, second point is establishment of open airway. In the establishment of open airway, majority of baby will cry at the time of birth because it will take the spontaneous respiration. Immediately suction the secretions. You will wipe the mucus from the face, mouth and nose. So we will do the suctioning for the baby. Same wise, we will wipe the mucus secretions from the baby's face, mouth and the nose. Next, third point is Apgar scoring. So Apgar indicates what? A for activity, P for pulse, G for grimace, that means reflex irritability, and one more A for appearance, it means skin color, and R for respiration. So in the Apgar scoring system, they are giving some points, that is 0 point, 1 point and 2 points. So in 1 point, what is the baby's reflexes? So first is that activity. In the activity, what is the score of the scoring system of the newborn baby? So first activity means muscle tone. 0 points, it will indicates absent. In 1 point, the baby arms should be flexed as well as the legs also flexed. The second points, the baby should be active. Second is that pulse. In the pulse, 0 point, the baby pulse is absent, we will give 0 point. The baby pulse is below 100 BPM, we will give 1 point. The baby pulse is over 100 BPM, we will give 2 points. Next, third one is grimace. In the grimace, we will see the reflex irritability. So 0 points indicates it should be floppy, and 1 point indicates we will give minimal response to the stimulation to the baby. Second point, we will give at least some response to the stimulation to the baby. And the fourth one is appearance. Appearance means we will see the skin color of the baby. If the baby's skin color is blue or pale, we will give the 0 points. If the baby skin color is pink, the body should be blue and also extremities, we will give 1 point score. And the second point score, it will indicate pink color. And at last, respiration. Respiration, the baby respiration is absent, we will give 0 point. The baby respiration is very slow and the respiration is irregular, we will give second point. And the second, we will give the first point. And the second point, vigorous activity, we will give 2 points. So these are all the Apgar scoring system seen in the essential newborn care. What is the total Apgar score? The total Apgar score is 10. So in the total Apgar score, it will be divided into 3 types. First is no depression, second is mild depression, third is severe depression. So no depression indicates 7 to 10 score. If the baby having no any depression, it will includes 7 to 10. If the baby having mild depression, we will give the score of 4 to 6. If the baby is having severe depression, we will give the score of 0 to 3. So in the essential newborn care, Apgar scoring system is very important. Mainly the doctor will assess the Apgar scoring system out of 10. Next, initiation of breastfeeding. After giving the Apgar scoring system, we will start to initiate the breastfeeding as soon as the possible. The baby will birth within the 1 hour of birth. So initially we will start breastfeed the baby within a 1 hour of birth. After 6 months we will start the weaning diet. Next, newborn identification. In the newborn identification, before the baby leaves the delivery area, identification bracelet with identical numbers are placed on the baby and the mother. Before the baby will leave the delivery room, one of the identification bracelet or identical number should be given to the baby as well as mother, because for easy identification bracelet and identification number should be given for both baby and the mother. Next, injection vitamin K. After the baby will birth, injection vitamin K should given mainly to prevent the hemorrhage. During the first few days of life. Before infant is able to produce vitamin K administration. So if the term infants is 1 mg, you will administer the vitamin K in the route of IM. If the baby is in preterm infants, 0.5 mg in the route of intramuscular route. Alternative route is, two route is there. One is oral dose, another one is repeat dose. In the oral dose, 2 milligrams, that is orally at birth, repeat dose 2 mg at 3 to 5 days, or otherwise 4 to 6 weeks of age we will repeat the dose. Next, daily routine care of neonates. So after the baby will birth, some of the routine care, that is daily care, should be given to the neonatal baby. What all the care is? First is warmth, second is breastfeeding, third one is skin care and baby bath, fourth one is baby bath, fifth one is care of the umbilical cord, sixth one is care of the eyes, seventh one is clothing of the baby, eighth is general care and the observation, ninth is taking the anthropometric measurement, 10th is immunization, at last follow up and advice. So these are all the some of the daily routine care. It is very important to give the neonatal baby. In this, first thing is warmth. The baby will provide thermal control and to maintain the normal body temperature and to maintain the skin to skin contact between the mother and the baby. From that purpose, we will provide the baby should be warmth. Warmth is provided by keeping the baby dry and wrapping the baby with adequate clothing in 2 layers. In the 2 layers, the head and the extremity should be fully covered. Second is, baby should be kept by the side of the mother. The baby should be kept only one side of the mother. Next, breastfeeding. In the breastfeeding, the mother will start breastfeeding to the baby within a half an hour of baby birth. Initially, the breastfeed will start as soon as possible. Next, skin care and baby bath. Mainly in the skin care, the skin should be cleaned of blood, mucus and meconium by gentle wiping before he or she is presented to the mother. So, the skin should be fully wiped with blood, mucus and meconium with the use of gentle wiping when he was with the mother. With the use of baby bath, the baby bath should be given at the hospital or the home by using only warm water. Baby bath should be given both hospital also as well as home only with the use of warm water. In the second picture, the mother is bathing the baby only with the use of warm water. The first picture shows that the baby will take care of the mother will take care of the baby's skin, cleaning the baby's bodies. And the third one is cord blood collection. In the cord blood collection, make sure cord blood is collected for analysis and sent to the laboratory for checking of RH blood type and possible cord blood gases. Before going to collect the cord blood is collected mainly from the umbilical cord. In the cord blood should be sent to the laboratory because of for checking their RH blood type as soon as the cord blood gases. Next, care of the umbilical cord. In the care of the umbilical cord, keep the cord should be stump clean and the dry. The umbilical cord should be very clean and the umbilical cord should be kept dry. Second is, topical application of antiseptic is usually not necessary unless the baby is living in a highly contaminated area. Usually when we are cleaning the umbilical cord, only with the use of application of antiseptic solution should be used. So, and when you should apply the antiseptic solution, the baby is living in a highly contaminated area, at the time we will apply the antiseptic solution. When it is necessary, you will use. It is not necessary, no need to use. Second is care of the eyes. In the care of the eyes should be cleaned at the time of baby will birth. Once in every day. Every day you should clean the baby's eyes with the use of sterile cotton swabs soaked in a sterile water. So next is that separate swab for each eye. When you are cleaning the baby's eyes, we will clean the separate swab for both baby's eyes. Next, clothing of the baby. The baby will wear only loose, soft and cotton clothes only. Second, large button, synthetic frock and plastic or nylon napkin should be completely avoided at the time of baby clothing. Next, general care. In the general care, rooming in, aseptic technique, tender loving care. Rooming in means the baby and the mother should not be separated. The baby and the mother should be kept in the same room only. And in the general care, you will follow the only aseptic technique. After the tender loving care, both mother and baby bonding should be there. They should maintain the trusting relationship between one to each other. Observation. When we are take care of the baby, continuous observation is very important. Why continuous observation is? Continuous observation for you have to detection of any abnormalities to the baby. So the baby should be kept in continuous observation. Once, twice daily we have to observe the baby. We have to detect any abnormalities. From that purpose we will observe the baby. Next is that anthropometric measurement. In the anthropometric measurement, mainly we will measure the first baby's length, second baby's weight, next third one is head circumference and the chest circumference. First we are going to see the weight of the baby. So the normal weight of the baby is 2.5 to 3 kg. The average daily weight gain in healthy term baby is about 30 gram per day in the first month of life. Mainly what is the average daily weight gain of the baby is only 30 gram per day in the first month of life. In the first picture, the nurses is measuring the weight of the baby with the use of electronic machine. Second is that length. Length is otherwise called as height. From top of head to the heel with the leg fully extended. When you are measuring the length of the baby, the top of the head to the heel you will measure along with the leg should be fully extended. What is the average range of the length of the baby is 46 to 56 centimeter. In the second picture shows that the doctor as well as staff nurses will measure the height of the baby in the stadiometer machine. Next, head circumference. What is the normal average range of head circumference is 33 to 35 centimeter. So in the third images, the doctor will measure the head circumference of the newborn baby. So before going to measure the head circumference, we will take the inch tape, place the inch tape measure above your eyebrows and stretch around the fullest part of your occipital region at the posterior frontal area. Next, chest circumference. In the chest circumference, mainly we have to measure at the nipple line. We will measure the chest circumference of the newborn baby. What is the normal average range of the chest circumference is 30 to 33 centimeter. After this chest circumference, we will go for immunization. Immunization is a very important thing. After the baby will birth, immunization is very important. Each and every baby will administer the vaccination to the all over area, to all over India. So all neonates should be immunized with BCG vaccine and 0 doses OPV vaccine. So BCG vaccine, what is the abbreviation is Bacillus Galmate-Guerate. Second point is hepatitis B vaccine should be administered at the time of birth, the first dose, and the second doses is 1 month we will give the second dose, and after that 6th month of age we will administer the second doses of hepatitis B vaccine. Next is that follow up and advice. At last, follow up and advice is very important. What the nurse says, what the doctor says, each and everything should be followed in a day-to-day basis. Each infant should be followed up at last once every month for first 3 months and subsequently 3 months interval till 1 year of age. So each infant should be follow up once in first 3 months of age, at last subsequently 3 months until 1 year of age we will do for further follow up checking and advice of the nurses as well as doctors. At last, thank you to all.